everybody. You all must be wondering who we are and what are we doing here. So let me give you an insight about it. We are PG scholars from Luqman Unani Medical College, Hospital and Research Center. I am Dr. Mohammadi, second year postgraduate student from General Medicine Department.
I, Dr. Asia Arbin from General Medicine, first year PG.
So we are here to celebrate and to give you an insight about World Heart Day, which is celebrated every year on September 29th.
So ma'am, what is the history behind the World Heart Day?
Yes, Asia, let me give you a brief detail about the history. World Heart Day is celebrated annually on September 29th. And why is it celebrated? To raise awareness about cardiovascular diseases and to promote global heart health. It was established way back in 1999 by the World Heart Federation in association and collaboration with World Health Organization. The first World Heart Day was celebrated and observed on September 24th, 2000. Initially, every last Sunday of the September was celebrated as the World Heart Day. But later on in 2011, it was given a fixed date, that is September 29th. The first person to celebrate this and to conceive this was Anthony Baez de Luna, who was the WHF president who served his presidentship from the period of 1997 to 1999.
So ma'am, what is the theme for this World Heart Day?
Yeah. There is absolutely a theme. Every year we have a theme for every day that we celebrate, be it the Health Day, Heart Day. So this year, the theme for World Heart Day 2024 is Use Heart for Action. Like it was Use Heart, No Heart last year. The same way we have a theme that is Use Heart for Action. This will be the campaign from 2024 to 2026. And this will be the purpose. The campaign from 2024 to 2026 will be under the theme of Use Heart for Action, supporting individuals to care for their heart and empowering them to urge leaders to take cardiovascular health seriously by providing a global platform for action. The action is deliberate and impactful execution of efforts. It highlights a shift from awareness to empowering with a clear purpose and goal. There is also the two-way nature of action, efforts to influence policies and advocate for behavioral change and physical activity. It reflects the requirement for sustained efforts and collaboration.
So that's such a nice theme, ma'am.
Isn't it?
Yeah. So ma'am, by your theme, I have understood the objective that to raise awareness about the cardiovascular diseases and to promote the heart health. I am not wrong?
No, you are absolutely not wrong. Along with the objective, there is also a global initiative which is led by the World Heart Federation, which is to encourage healthy lifestyle changes and emphasize on the importance of heart health.
So ma'am, next, what is the importance of this World Heart Day?
It holds a huge importance, Asia. That is, the leading cause of death globally, responsible for approximately 20.5 million deaths per year, is cardiovascular disease. It includes heart diseases like heart attacks, hypertension. There are several number of diseases. When coming to the male to female ratio, men have a higher risk of cardiovascular diseases earlier in life, with a typical ratio of 3:2 for coronary artery disease.
So ma'am, so the male and female ratio is equal?
No, it is not. Like I already told you, the men have higher risk for cardiovascular diseases compared to women. The ratio is 3:2. However, women's risk increases postpartum, especially for conditions like stroke and heart failure. And there is also something called as preventable risk. About 80% of premature deaths from heart diseases and stroke can be prevented with proper care and awareness.
Ma'am, you have said me about the ratio of a male and female. So can you say me who is at the risk?
Yes, definitely, Dr. Asia. There are risk factors for every disease. Likewise, for heart diseases, there are modifiable risk factors and non-modifiable risk factors. And what do we understand by it? Modifiable risk factors are such that it can be reversed. That is in your hands. Non-modifiable is something that a person has nothing to do with it. So, the things that are included in modifiable risk factors are smoking, poor diet, physical inactivity, high blood pressure, obesity, and high cholesterol. And coming to the non-modifiable risk factors, there is age. Risk increases with increasing age. Gender, like I already told you, with 3:2 ratio, men are generally at higher risk, though risk for women increases after menopause. And family history, genetics play an important role in heart health.
So ma'am, can you explain me that what all the patient suffers when he gets any attack or some of the disease?
Yeah, sure. So some of the symptoms of any cardiac emergency will include chest pain. The pain can be, a person can experience tightness in his chest, or it can be like stabbing type, or he can feel heaviness in his chest. There might be shortness of breath which a person can experience. There might be profuse sweating. It also depends on what type of disease the person is having. These are the common symptoms: sweating, nausea, vomiting, dizziness and fainting, pain in upper body. Like everybody is familiar that the person having a heart attack will be experiencing pain on the left side of his body, that is to the shoulder, left side of the neck, lower jaw, and the left hand. And the other things will include palpitation, rapid or irregular heartbeat, and person will be extremely tired. Now, if someone experiences these symptoms, they should seek emergency medical help immediately without any delay.
So ma'am, what is the common cardiovascular emergencies?
The symptoms I just mentioned can happen in conditions like MI, myocardial infarction, which commonly you can call as heart attack, cardiac arrest, pulmonary embolism, that is blood clots are formed in the lungs which might travel to the arteries in the heart, aortic dissection, hypertensive crisis, which is dangerously high blood pressure. And there might also be heart failure, which can be acute or it can be a chronic thing, and it can flare up, which might result in the symptoms that I have mentioned, and it can result in any emergency.
Ma'am, so can you give some tips to keep the heart healthy?
Yeah, now that you have known the incidents, the risk factors, the symptoms, all these things, risk factors like I told you, modifiable, non-modifiable. Modifiable, whatever risk factors were included, reversing those things or quitting those things will help you a lot in keeping your heart healthy. To list them out, you can consider being active, engaging in physical activities like walking, swimming, cycling, etc. Then eating smart. A heart healthy diet includes lean proteins, whole grains, and reduce processed food intake. Quit smoking and alcohol. Avoid tobacco, and if anybody is drinking alcohol, just ask them to decrease it and then quit it. Manage stress. Stress is a huge factor for a person to experience any cardiac emergency, or be it any kind of anxiety or anything. Managing stress is important. Practice relaxation techniques such as yoga and meditation. Also, keep a track of your numbers. That is your blood pressure, cholesterol, blood sugars. If a person is already having the condition, he must and should keep a track of his numbers. Also, there is a call of action that a person can do. That is an individual responsibility and the changes that a person can bring in society. There is personal responsibility. That is, take care of your health by adopting healthy habits that I've already told you earlier. Encourage others, that is, spread awareness like we are doing today. The same thing, it can be done by any person who has this knowledge. Spread awareness by sharing heart health tips with friends, family, and anybody. Community involvement is necessary, like participating in local World Heart Day events such as free health screening campaigns, fun runs, or heart health talks.
So ma'am, we have understood the symptoms and risk factors and emergencies about the CVS, and now we have so many myths. So let's bust it together for the people.
Sure. So are you gonna ask me?
Yeah, I'll ask you some of the myths. Please bust it.
Yeah, sure.
Heart disease only affects the old age people?
No. It's not like that. Heart diseases can affect people of any age. Risk factors such as obesity, type 2 diabetes, high blood pressure are becoming more common in younger population. So age is, it does increase, the risk is increases with increasing age, but it is not like it affects only in older people. Like people have, every other day you see in news, 24-year-old experienced cardiac arrest, 42-year-old died because of cardiac arrest. So this is the thing.
Okay. So the next is, I would know if I had a high blood pressure, because these would be a warning sign?
No, not necessarily. High blood pressure is often called as a silent killer because it usually has no symptoms. Therefore, regular checkups are essential to detect and to treat and to prevent any cardiac disease.
So ma'am, if I am fit and active, I don't need to worry about a heart disease?
No. It's not like that. While regular exercise is crucial for heart health, it doesn't eliminate the risk entirely. Other factors like diet, genetics, lifestyle choices also play a significant role.
So the people say heart disease runs in a family, so there is nothing I can do to prevent it? No,
it's not like that. You have to first understand why we know the risk factors. Modifiable risk factors, of course, you can reverse it. Non-modifiable risk factors are known because you are aware of it and you can take care of yourself. Even if you have a family history of heart disease, you can take steps to reduce your risk. Eating healthy, exercising regularly, avoid smoking. These things can significantly lower your chances.
I'll know when I'm having heart attack because I'll have chest pain.
That is quite a controversial thing, but let me clear it out for you. Heart attack symptoms can vary and may include shortness of breath, nausea, lightheadedness, discomfort in areas like arms, jaw, neck, or back. These are the common symptoms, but sometimes there might be silent attacks also where a person is not aware. That is why we are stressing on keeping a track of your health and the numbers of your BP, sugars, and all of that.
Taking cholesterol lowering drug means I can eat anything I want.
Of course not. Diet, healthy diet. I've been stressing on it. Cholesterol lowering drugs help manage cholesterol levels, but they are not a free pass to eat unhealthy foods. A balanced diet is still essential, right, for heart health.
Diabetes won't harm my heart as long as I take my medication.
Medications are necessary. But then it's not like diabetes is not going to do anything, because everybody in this profession is aware that diabetes is not just a disease, it is a syndrome. There are a lot of things involved, multi-system disorder it is. Managing diabetes is crucial, but it doesn't eliminate the risk of heart diseases. High blood sugar levels can damage the blood vessels, and it can increase the risk of heart diseases and stroke.
Ma'am, it is, and so that there is a last myth.
Yeah.
It is okay to have a high blood pressure when you are older?
No, high blood pressure is not a normal part of aging. It should be managed at any age to prevent heart diseases and stroke. So we are done with the myths and facts,
yeah.
right?
Yeah, done. So ma'am, can you drop a message to take home?
Yeah, definitely. Every individual has the power to reduce the risk of cardiovascular disease. Start today by making heart healthy choices, educating others, and staying informed about your heart health.
Together we can make a difference in combating heart disease and promoting healthier world.
Yeah, with this take home message, we finish our education session with a warm gratitude, and we say thank you on behalf of our college and from both of us.
So, be healthy, be safe.